I'm Dr. Amy Osenbaugh, and I wanted to add a video to my website explaining the Atlas orthogonal work that I do in Ankeny, Iowa. So I'm going to try and explain it to you without someone asking me questions, just what the Atlas work is all about. I specialize in the Atlas, which is the top bone of the spine, but probably 85% of the new patients walking into my office come in because of lower back pain. Neck situations are a quick, easier fix than the lower back, but the lower back can also be helped greatly, and I'm going to explain to you why. I'm going to show you a picture over here. The Atlas is the very top bone of the spine. It's the bone that your head sits on. You can see in this picture here, and there's other pictures on my website showing this, but that top bone of the spine should be level like you see here. But when the top bone tilts, the second bone has no choice but to also tilt. And when the second bone tilts, the third bone tilts, and the fourth bone, etc., all the way down the spine. That's how the Atlas being off can cause curvature through the spine and cause problems anywhere through the spine. But it also causes the pelvis to tilt, because when the spine is curved, the pelvis is going to tilt. The only way the pelvis can be level is if the top bone is level. When the top bone comes level, the second one has no choice but to come level. And then the third, and then the fourth, and then the fifth, etc. It's like dominoes. When the top's level, that's what straightens out the spine. If the spine is straight, that's what levels out the hips. It's not what I do here that helps the lower back, because I can work and work and work on rotation, which is what adjusting the lower back works on, is rotation. But if it's always tilted, it's never going to feel great. So the goal is, let's see what's going on here. Focus on bringing that level. When it's level, not only are the hips level, but the knees are level, the hip joints are level, and the leg length is level. That's one of the primary tests I use to determine if someone's a candidate for Atlas work, is I take a look at the leg length. If one side is short, laying on their back on my table, then I know the short leg is a high pelvis. And if the pelvis is tilted, the spine has to be curved. And if the spine's curved, it's because the Atlas is tilted. And that can affect into the shoulders and the elbows and the wrists. So when a patient comes in here with a symptom, it's not that I do anything specific for that particular symptom necessarily. What I do with a new patient walking in is I take x-rays on the spine. 100% of what I do is based on what the x-rays show me I need to do. The x-rays show me how much tilt is in the head, how much twist is at the Atlas, if there's flexion, extension, and we look at the full spine too to see what all needs to be done in the spine. But if the Atlas isn't right, it doesn't matter what I do the full spine. I'm going to show you on the spine over here what's going on with the Atlas, or where the Atlas is. This is the spine here, okay? And this is the back of the head. So it's like I'm standing here right now. This is the back of the head. Here's the back of the head. The Atlas vertebra is this bone here. It's up underneath the base of the skull. It's not something that every chiropractor can adjust. When I take x-rays, I'm looking to see how much twist or turn is going on up there at the base of the skull. My contact point when I adjust an Atlas is here. It's here. It's not back here, because back here you have 2 to 3 inches of skin and muscle before the Atlas, you ever get to the Atlas. So I can't contact the Atlas from the back like people would expect. My contact point is right here underneath the ear. The jaw sits right in front of the Atlas vertebra. So it seems like sometimes I'm doing something to the ear when I move it out of the way to get to the Atlas, but that's how I get to it, not from the back. But you can see when I hold this, if I turn that, although that's a lot, when it turns, everything turns. One analogy I use with my patients a lot is I tell them, hold a shoestring in your fingers. That shoestring represents the spine. My fingers represent the Atlas. If the Atlas turns, so does the lower back, right? So let's say I was a chiropractor who didn't specialize in the Atlas. Let's say I said, let's fix your lower back, that's where your problem is at. What happens if I turn and try and untwist the lower back? What happens when I let go? It goes right back, right? But what happens to the bottom of the string if I unwind up here at the atlas? It all turns. And that's what I have to do before I ever think about doing anything to the lower back, is I have to get this level, I have to get it untwisted. The atlas vertebra in this picture is right here. You see underneath the atlas vertebra, that's the spinal cord coming down, and it's inside every single vertebra of your spine. But every nerve of your body, all these nerves coming out, including the ones coming out here in the lower back, all those nerves originate in your brain. Your brain has all those nerves in it, and they all come out through here and then leave the spinal cord. So this nerve you see here, it comes through the atlas, on down in the spinal cord, and has to go through all these vertebrae before it ever comes out to the heart. Or all these nerves here, these are the same nerves I'm showing you on that picture. All these nerves that are numbered come from the brain. So someone can tell me I have pain here. Yeah, T6 comes out in the middle of the back, but it also has to go through all these vertebrae before it ever gets to that area. So I can't just say, oh, you hurt here, let's do something there. I can't just say, oh, you're having some stomach issues, let's just look here. The big picture is that every single nerve has to go through the atlas vertebra. It's kind of like the breaker box in your house. If the breaker flips, it can affect, the coffee maker or the toaster or something further on down the line. But you don't just go to those things and say, hey, I broke my toaster. You look where it's plugged in, you look at the breaker box, and then you look at the main power source. So I start always making sure this is open before I ever try to address any individual area of the spine. I do look at the full spine, but not until I get this right. This is 99% of the importance of what I do. I've got to have that open so there's blood flow and nerve flow coming all the way down to all your organs. Every organ of your body is controlled by nerves. I don't treat symptoms. I don't treat headaches. I don't treat back pain. I don't treat stomach issues or headaches or bowel problems. I know all those things could be better once I get the atlas right. So the big picture is to focus on what could be causing all of those symptoms and focus on that issue. Now I'm going to show you the machine that I use, which looks scary, but I promise you it does not hurt at all. This instrument here is what I use to adjust the atlas vertebra. It's the only instrument I use in this room to contact the atlas. It's absolutely painless. Most patients after their first adjustment say, oh, was that it? This instrument here, you're going to see a lot of numbers. There's numbers down here that you can't see on a video necessarily, but there's several numbers that I have to program or set in this instrument after I've taken the x-rays. After I take the x-rays of a patient and I see the exact amount of tilt, rotation, flexion, extension, what's going on with the rest of the spine, everything on here is set. This instrument right here, this stylus you see here, that's what is placed on the tip of the atlas vertebra. It may be left, it may be right. Every patient's individual. But that's what I place on the patient's neck. The patient will be laying on their side on this table. I'm going to grab my spine. The patient will be laying on their side here. And like I showed you before, my contact point is right there. It's a very gentle correction to start moving that atlas back to level. So we place this over here. It's going to be sitting on the atlas vertebra. The patient will hear a click that you'll hear, but they don't feel anything. It's a vibration. It doesn't poke them, it doesn't shock them, it doesn't force anything. And patients that have had hands-on care before will be surprised because they've had a lot of force used that it takes so little force to start moving that atlas vertebra. One thing I wanted to mention thinking of that is a lot of patients ask me when I show them this, how long is it going to take me? How many adjustments is it going to take? How long am I going to be coming in here? I tell a patient, if the atlas is off 8 millimeters, it'll be 8 adjustments before it's level. Approximately. Everybody's different. It could be someone that's off 2 millimeters, it takes 8 adjustments. Or it could be someone that's off 8 millimeters is good in 2 adjustments. You just never know, as far as their atlas goes, how quick it's going to move or how well it's going to hold. And it's not that I can do something different or better to make it hold sooner. It depends upon the patient's trauma, what their neck has gone through. Everybody's unique. And that's a nice thing about what I do with the atlas orthogonal work, is every patient's unique. It's not that every patient gets their neck moved left or right or their pelvis moved left or right. It's really what the x-rays show me. It's very unique for each individual patient. So I hope this gives you a good overview so that you can watch this video before you come in for an initial consultation. And then when you come in, you've kind of got the big picture, and then we can focus on you as an individual patient and say, okay, now what's your situation? Then go forward with the x-rays and decide what your plan of care is. So please feel free to give us a call, 965-7835. My front desk gals will get you scheduled, and I'd love to meet you. Thanks for watching.